Good morning, everyone, and thank you so much for joining us. This morning we're here at Melrose Pharmacy, which has served this community with care and creates the personal environment that makes dealing with prescriptions feel like less of a chore. I want to thank Teresa Dickinson for hosting us and the rest of your team for serving as a great example in the industry. And I want to start with a statistic. 1 in 3. That's how many Americans have foregone medication due to costs. While a staggering statistic on its own, the people behind the statistic are why we are here today. We're here for parents, grandparents, workers, seniors, and so many other Arizonans who have not been able to prioritize their health and the health of their loved ones because the cost of prescription drugs has gotten out of hand. With little to no guardrails, transparency, or accountability, bring it to an end. Today, I'm proud to unveil my plan to protect Arizonans from price gouging middlemen and make sure they don't have to sacrifice their health just to get by. First and foremost, my plan will create a prescription drug affordability division within the Department of Insurance and Financial Institutions. Right now, there is no state entity explicitly responsible for helping Arizonans save money on medication, despite the clear need for it. Will also require increased transparency on the rebates that pharmacy benefit managers are supposed to be using to lower costs for Arizonans, but in many cases aren't. Right now, PBMs are on an honor system and have shown time and time again that they can't be trusted to pass the savings on to Arizonans. With increased data available, we will be able to ensure that customers are actually getting the savings. My proposal also helps safeguard taxpayer dollars by preventing pharmacy benefit managers from overcharging Medicaid through a practice commonly known as spread pricing. These companies often fill their pockets with taxpayer dollars by charging Medicaid more than they actually pay a pharmacy for a prescription. We saw this happen in Ohio, where pharmacy benefit managers overcharged $244 million in just 1 year. And I'm not going to let that happen here. I've known the gravity of having to make tough decisions in order to stay afloat financially, and I know that every penny counts when it comes to savings. I've always believed that as elected officials, we have a responsibility to make life easier for our constituents. While it's great to see some in the federal government taking this issue seriously, change is not happening fast enough. We can and we must act now. No Arizonan should have to choose between paying their rent or buying groceries and affording their prescription drugs. It's time to put an end to a system that takes advantage of Arizonans and leaves people behind. It's time to lower the cost of prescription drugs so Arizonans can afford life-saving medication and get the health care they need. And with that, I'll hand it off to Senator Burch.
Good morning, everyone. Thank you all for joining us today. I am State Senator Eva Burch, and I represent Legislative District 9, and I'm proud and excited to have the honor of sponsoring Senate Bill 1533. For years, drug companies and middlemen have engaged in aggressive price gouging, raking in massive, record-breaking profits year after year to the detriment of millions of people who need their medications to survive. As a practicing medical provider, I have seen this firsthand, and I know that for many, this is a matter of life and death. As a legislator in a state where over 1 million individuals live with chronic conditions like cancer, clotting disorders, diabetes, and heart disease that require prescription drugs for treatment and management, this kind of legislation has the potential to impact Arizonans in a really meaningful way. More than a quarter of Arizonans reported having stopped taking their prescriptions due to cost alone. This is unacceptable. No one should be forced to choose between essential medications and putting food on the table. As a mother and a healthcare professional, I know that passing this bill will not only lower the cost of living for Arizonans, but will offer so many people the financial security that they have been working towards and that they deserve. The bill does 3 things to put more money back in the pockets of Arizonans. It will require pharmacy benefit managers, or PBMs, to get approval from the Department of Insurance and Financial Institutions Prescription Drug Affordability Division before increasing the cost of any prescription drug beyond the rate of inflation. It will require PBMs to report quarterly on the aggregate amount received through the drug manufacturer rebates and to demonstrate how these savings will be shared with the consumer. PBMs often receive payments from drug manufacturers that offset or eliminate the cost of the drugs that they cover, and they pocket these profits, while patients and insurers see no savings. It will prohibit spread pricing, so PBMs will no longer be able to overcharge insurers for prescription drugs. And finally, it will establish the Prescription Drug Affordability Division at DIFI to enforce these provisions and identify more innovative ways to save Arizonans money on medications. It doesn't matter what your political party or your socioeconomic status is, you deserve to live with dignity and you deserve to have access to affordable prescription medications. So thank you all for joining us, and I would like to pass it over to Teresa Dickinson.
Hello, my name is Teresa Dickinson, and I'm a pharmacist and the owner of Melrose Pharmacy. I have owned an independent pharmacy for over 18 years. I am here today to tell you about my experience with the PBMs and why you should care about who they are and what they are doing. I opened my pharmacy to help patients insert my problems with the PBMs right away. Every year I told myself it couldn't get worse, and every year it did. Who are the PBMs? Prescription middlemen. First designed to be payment processors, kind of like credit card processors, the idea was great. Pharmacists could bill real time and know that a prescription was covered and that what the patient's copay was, and then get paid timely for their services. Over the time, their roles have changed to enhance their profits. Now, after being allowed to be vertical integrate, they dictate what they pay pharmacies, control the formularies, own their own retail and mail order pharmacies that they steer to, own their own hospital systems, doctors' offices, and more. The top 3 PBMs own 80% of the market, forcing pharmacies into take it or leave it contracts in order to serve their patients. Since I opened, we have a term that independent pharmacies call PBM abuse. Here is an abbreviated list of my PBM abuses I have endured. Patients can't fill the prescriptions at my pharmacy. They're being steered into the PBM's own pharmacies, often at a higher cost. Patients have paid inflated copays. The pharmacy has been paid a lesser amount, and the PBM is recouping that amount, or this was happening, recouping that amount back from the patient's pocket instead of charging a lower price to the patient. The PBMs have gagged pharmacists into talking about their pricing schemes. Contracts have forced arbitration, diminishing the pharmacy's ability to sue them for misappropriate behavior. The contracts refer to a handbook, and then they change the handbook as they see fit. I get paid in over $10,000 of below-cost claims every month, and there's nothing I can do about it. The PBMs have forced manufacturers to raise prices so that they can give rebates, kickbacks, back to the PBMs. Some rebates are over $600 per prescription. All these overcharges increase your healthcare premiums. One PBM was recouping $27,000 for me because we put the wrong pharmacist's name on a prescription, on a transfer label. We can appeal, but then we're appealing to them. PBMs have created a fee called DIR fees. The money is supposed to go back into the plan to help reduce healthcare spend, but no one can follow the paper trail. I paid $300,000 in DIR fees last year. These fees are a profit center for the PBMs. They're abusive, excessive, and not being used for the purpose they were created. One PBM changed the handbook, and then they made it say that I couldn't work with outside vendors, dictating what my business practices should be. They forced me to reverse $70,000 in prescription claims of prescriptions that patients picked up, or else I'd lose my contract. There was nothing I could do about it. My pharmacy cannot endure the middlemen abuses anymore. I am barely at break even after being in business for 18 years and filling 200 prescriptions a day. Independent pharmacies are going out of business every day. What happens to the patients that rely on them? When rural pharmacies close, those patients have to travel very far to get their prescriptions. When patients don't take their prescriptions correctly, the whole healthcare system suffers. We've passed bills against the abuses, and they're still violating them because there isn't a regulatory body above them. Governor Hobbs' creation of the Prescription Drug Affordability Division is a giant step in stopping the middlemen from abusing their role in the system for their own profit. Mark my words, the Prescription Drug Affordability Division is going to save Arizonans and the healthcare system a ton of money. Thank you, Governor Hobbs, for tackling this urgent and necessary problem. Thank you. And now I hand it off to Marshall.
Good morning. My name is Marshall Militano, and I would like to thank Governor Hobbs and all those that are working so vigorously to control the cost of prescription medications. I am a retired bus driver from Deer Valley School District, and the cost of my diabetes medication that I've been managing for over 20 years was taking more than half of my Arizona State retirement. Now, that's almost criminal, I think. We should be looking at those that need prescription medications, as Governor Hobbs is, and we need to be more transparent with their charging and the cost of their medication. So again, I thank the governor and her effort to control and maintain the cost of prescription medications. Thank you.